Actually, I do want to put in a break right now and just tell people that this is Curbside Consult. This is Harold Pollack having a wonderful conversation with Joanne Keenan of Politico and Politico Pro. And those of you who can do the subscription service to Politico Pro definitely should. It's outstanding. The
But also a little plug that our daily newsletter, there is a free version for the non-subscribers in the academic world or your viewers. I mean, there's something called Pulse, and you can go on the website and get the skinny catastrophic equivalent, I guess. I mean, yeah. It's very good though. Healthcare information needs every morning in your inbox.
I do wonder, by the way, let's talk about some of these horror stories that have been coming out. Sort of, obviously, many of them connected to the president's statement. If you like your insurance, you can keep it. There are all of these anecdotes about people losing their insurance and having to pay more. It seems to me that when you actually look at many of these anecdotes, they turn out to be totally wrong and misreported.
But all of them.
What's that?
Not all of them, though. I mean, here is where the two crises and the two political storylines intersect. You've got cancel plans. We don't really have it completely. I mean, the really good reporters that I trust are coming up with different numbers because there's no, central, data bank of every cancel plan in the country, but it probably is, I'm pretty comfortable saying it maybe in the 3 to 4 million range of people who have some kind of change. And we don't know, and it's not a number I would want to say under oath, but I think that's probably a pretty good ballpark of where we are now. And some people, including some progressives, are telling you it's higher. Where the intersection is yes, some of these people are going to be able to get another plan, and it'll be a better plan, and it'll either cost similar with better consumer protections, or it'll be way better for them because they'll be able to go on the exchange and say, oh, I can get a subsidy. I'm going to get a better plan, and it's not all going to come out of my pocket. Not every one of those cancel plan is a lousy, skinny plan. Not everybody is going to get a subsidy, and not everybody is going to have a happy ending. Right now, everybody, or many of these people, see themselves, I mean, we talk about winners and losers, and we talk about the net social gain and all those things. For the individuals who see themselves as losers and who don't know what the alternatives are because the messaging has not gotten through, and who can't, and even if they know, oh, well, maybe I'll get a subsidy, maybe I'll look into these metal thingamajigs and find out what's in it for me, they can't get on the website and find out. So you have these people who right now, I mean, I talked to a family that was making about $96,000. The cutoff for subsidy is around 94. Two parents in their 50s, so they're healthy, but they're in the higher bracket, and two kids. And it wasn't just sitting where I could get to. It was on a TV thing, and I couldn't get every question answered. But these are Obama supporters in California. Their insurance went from $3,000 to $13,000, and they're not going to get a subsidy. Okay, you and I can probably look at them and say, you weren't getting a whole lot for $3,000, but $13,000 is going to be an awful lot of money for that family, and there's no way around it. And we talk about apples and oranges, and the new plans are different than the old plans. Some people liked their oranges. Some people felt like, if you give me this level of protection, it's all I can afford right now, and I can, if a crisis comes, I can deal with it because I have some other, economic resources. And, for a healthy family, the crisis is less likely to come. They have some insurance. That is a family, this was a, liberal Democratic family from California. They're angry, they're worried. And if I were faced with a $13,000 bill on $96,000 for a family of four to get insurance, I would not be happy about getting that letter in the mail.
Well, I agree with that. A couple of things. One is, I do think there's an epic media fail in the sense that every single story, if someone's going to actually report on it, not if you're sitting in a studio and someone calls up and tells you their story, but every single story that you're actually reporting, there's really two incredibly complex steps that people have to do. One is they actually have to look at someone's old insurance policy to determine, whether it's any good. And it is striking that NBC, CNBC, NBC, they're reporting stories that on the most flimsy fact checking, it turns out this person really had almost no insurance before in many of the, and second, to actually look and say, okay, here's the letter from the insurance company that says it'll be 13,000, but here's actually what you can get if you actually look and see. This is where, of course, with the website being down,
Family actually got on the website. 13 was their bronze plan in the website.
So 13 was their bronze plan in the website. So what
And
was it? What were they getting for the 3,000?
probably not a whole lot, but the producer of that particular show had gone on the website and double and fact checked them. I mean, she did not read their entire policy before. And, you know, if I had been in a room with them instead of in a studio 3,000 miles away, you know, I would have had questions. I don't know how old their kids are. Are they on there? Are they still, you know, on their taxes as dependents? Are they 25? Could they go off and get their own plan?
My guess is that there's something in that. My guess is there's something in that story that is that there's a complexity to that story that if you actually had the time to do an OJ trial on it, that you would realize.
Look at some of what Charlie Ornstein's doing in ProPublica, because he's doing some of that, and he is finding some people who had. I mean, he's doing the reporting that you're talking about, and we're trying to do some of it too. But you know, we're not so. You know, we're more policy government focused. I have seen some stories taking these apart. And someone like Charlie's in a few of these families on ProPublica. It's a fabulous site. He's a fabulous reporter. And he's looking at them and finding, you know what, that plan wasn't so skinny. That plan was, you know, because somebody got in it and stayed healthy.
Yeah.
But those plans may be not good for the country because you had to be, there was underwriting to get in them. They're serving the healthy. They're serving the low risk. They're not all lousy plans.
No, and I think there had to have, I think that we, the supporters of ACA, myself, that we didn't prepare people for.
That's what the president said. I mean, I don't know that he was expecting this tidal wave of bad news at the same time. I mean, he certainly didn't anticipate. You know, I thought it was really interesting when he was, you know, in the NBC interview, he said, "I've been burned," and he corrected himself. You know, "I've been burned by the website." And he says, "I mean, the American people have been burned by the website." But you know, I think for the advocacy community. You know, as I said, these stories are colliding, and everything comes back to the website because you can't tell somebody, I know you're upset by this letter. I know you're used to your plan. I know you're worried about it. Take my word for it. Someday this website's going to work and you'll be able to get on and get a subsidy. You can't. It's the reality of having your plan canceled versus the reality of not really being able to find out about anything else.
By the way, I wonder if 2 months from now, when I think the website will be working, whether the media will be bored with the current narrative and where there will be a new narrative that says, actually, Obamacare, there's a lot of good things here.
Well, I've seen some stories. I mean, there was a very good LA Times story that has been all over the place on, you know, somewhere where they did sit down and it's the narrative you're saying somebody thought their plan was wonderful. They had to go into a new plan. When they sat down and read through the whole thing, they realized the old plan wasn't so good. The new plan is only costing $40 a month more with the subsidies or whatever this woman was getting. And she ended up with all these great, you know, better benefits and better coverage. And she was very happy. I mean, I think the narrative is going to change many, many, many times. I don't think the media is going to necessarily get bored. I mean, if you have like, you know, if you almost go to war with Syria, you're going to hear about something else for a while. But then what do we know about Obamacare? It always comes back. So I think the narrative will change as the story develops. If the website is not working at the end of the month as promised, and I don't think anybody knows for sure, you know, there's not going to be a lot of great headlines about that.
No.
If people start signing up, I mean, one of the things we just ran a story yesterday, trying to sort of prepare, you know, it doesn't matter if young people sign up in October. It matters if they're signed up by the end of March. And trying to keep that in perspective. And we wrote a story yesterday, and it's at one people can find free. It's not behind the paywall, you know. We said that young people are going to be it's like a term paper. You know, either they're going to sign up on Thanksgiving when their mother makes them, or they're going to wait until 11:30 at night on March 31st and sign up. Then if they sign up, we didn't predict that, you know, there's still a debate about whether they sign up. But seeing a paucity of young people right now, or when we get we get enrollment figures next week, and I don't know, we're getting the age breakdown. I don't think we know very much, and I don't think it matters all that much about who enrolls in the first few weeks. Logically, it's going to be the people who need insurance most. It's going to be the riskier part of the
Yeah,
risk
because
pool.
they're the people who are willing to go through the incredible hassle.